World AIDS Day has been running annually every single year, but this year I think 2020 is probably even more important. And the reason for that is because actually we're dealing with two viral epidemics or pandemics, aren't we? So a lot of the message at the moment is to kind of bring those together and have a much more coordinated global effort to obviously deal with and eradicate the COVID-19 pandemic, which of course is the thing which is on our mind all the time, but also to reduce and defeat HIV/AIDS as well. So this year, the common messages are that working together to defeat both of these viruses, the two, but also the other messages, which are messages that have been consistent over the years, have been prevention and also then early treatment, because early treatment means that people who are treated early can expect to live a normal life.
And what can you tell us about the treatment available locally and the steps people should take in order to get themselves checked, for example?
So one of the things that has been a huge success story from the GHA is the Well Person Unit, and that was opened in October 2018. And the idea behind the Well Person Unit was to give us a combined presence within our community of family planning, sexual health, and health promotion and health screening. So it covers all of those things, all about well-being. That's why we call it the Well Person Unit. But one of their functions is sexual health. So we have dedicated and very highly trained sexual health practitioners. So if, for example, you have a worry or concern about a contact, even if we started at that early, you can call them 2000-7842. And we can make an appointment for you to be seen at the Well Person Clinic, and they will go through everything with you. So they'll start with a full history. They will ask you about you and about your health and about your well-being and any other medications and any other medical conditions, but they will also ask about your potential exposure, contact, who have you been with, how did that happen. They will ask very personal questions because they need to know everything that's going on, and of course anybody that goes there knows full well that they're absolutely in a confidential and utterly non-judgmental, safe environment.
And is the message of World AIDS Day getting through, in your opinion?
In terms of the message globally, the message is definitely getting through. There was a reduction in 2018-19 of 10% in terms of number of HIV infections, which are very significant in just 1 year. In terms of Gibraltar, I know that there is a reasonable waiting list, and by reasonable I can't give you the figures, but there is a reasonable waiting list for people to come to Well Person Unit. So what I mean by that is that the clinics are full, which means people are coming and people are taking this very, very seriously. And actually, that's the reason why we have things like World AIDS Day. So I remember being in my late teens, in the mid-80s, looking to go to university and live this kind of young and free lifestyle. And of course then came this very, very scary message about HIV/AIDS. So, but that was then. And of course the horror, the shock, the scare, it diminishes over time, and sometimes these messages can be slightly lost. But we mustn't forget, 38 million people across the world. So it's still there. It's still a significant infection with high level, good quality care. Somebody who has a diagnosis of HIV/AIDS can live a normal life, completely normal, a normal life expectancy, normal in every single way, provided they take their medication and they look after themselves. But we mustn't forget that the threat is still there. It's one of those things that people don't know about and could unwittingly come into contact with. And so part of this, having this prevention and World AIDS Awareness Day once a year. I know we've had lots of awareness campaigns recently, particularly November has been quite heavy on awareness campaigns, and it may be that people are just thinking, oh, what another awareness campaign, but we must keep these things alive. They're so important this year, particularly because of the coexisting pandemic of COVID.
And you mentioned there a waiting list for people to be checked, to be seen. But with the COVID-19 pandemic going on at the moment, have you seen, or can you tell us perhaps, that there's been an increase in people making sure that they are checking up on themselves because of this virus that's amongst us?
Yes, you know what I think, and you know, I've used the phrase waiting list. I don't mean a long waiting list as we would understand it. What I mean by that is that if somebody needs to be seen urgently, they always will, and we make sure that people will be seen as quick as is appropriate for whatever they need the care for. But I think this year has really focused people a little bit on their health and the understanding. We've all lived through this pandemic, and lots of conflicting advice and information about how we do, how we care for ourselves, how we look after ourselves, how we prevent this. But actually, it's interesting, isn't it? It's come back to the real simple things. Look after your health, look after your immune system, eat well, exercise, wash your hands, wear a mask in enclosed spaces. These are real simple messages, and they actually, interesting enough, apply to something more complicated perhaps, like HIV, where the very simple things: look after your immune system, be careful with your sexual contact, wear a condom all the time, and if you're worried, seek advice, and don't be ashamed to have a blood test, don't be ashamed to tell somebody, and have a screening. It's a responsible thing to do, because actually, in many ways, you can say, I've got a clean bill of health. So you, as somebody who perhaps is looking to form a relationship with a new partner, you can hand on heart say, I've been a responsible person, I've checked myself, I'm fit, I'm healthy, and I'm going to still listen to the advice, I'm still going to look after myself, I'm still going to wear a condom during any sexual contact, but I've been responsible and made sure that I'm fit and well and healthy.